So the laser is for basically the reason why we would use that is for women that don't feel as tight, that would have a little bit of stress incontinence. So when you laugh and you pee and you dribble a little bit, and lack of lubrication. So women that are like in the perimenopause or postmenopausal and they have some vaginal atrophy. So we would treat that. So basically, like, this is the internal wand that we would use. So it looks actually really big, but it actually is not too uncomfortable, and we do use some lubrication to get it in. And then, so this treats the internal, the vagina. And then we can do the external part, so the labia majora, labia minora, and the introitus, so very at the entrance of the vagina, with this probe here.
So what would it do on the outside?
So for the outside, and then it can just get a little bit more of the tone for the labia majora and the labia minora. So you can treat that. It is also approved to treat like the lichen sclerosis, which is like a skin condition, which is also something that I forgot to mention about with the PRP. So PRP, when I was talking about the O shot and doing it in the clitoris and then in the anterior vaginal wall, the PRP can be used to treat lichen sclerosis also. So you would inject a little bit of the PRP on the lichen sclerosis spot. But this here, again, can treat the vaginal atrophy or vulvar atrophy and also lichen sclerosis.
Will it change the way I look?
It can change a little bit the way you look just because of the extra tone that you would get. So less like loose skin.
And is this permanent change?
It is permanent, but you do require, basically you would require 3 treatments, 1 month apart, and then you would get your yearly maintenance. Okay. And when you get your yearly maintenance, it is only 1 treatment. It's not always like 3 treatments in a row.
Okay. Is it painful?
It is not painful. So basically the vaginal wall is not that sensitive, so I don't need any numbing agent when I do the vaginal probe. The outside, it is not painful, but you will feel it, but we do numb the area with just a numbing cream. So then you might feel a little sting here and there, but it's very well tolerated.
And can we do both in the same session?
The interior and the exterior? Mm-hmm. Yeah, so basically we can do both in the same session. And you could combine both treatment when you're talking about the laser, the Intima, and then the PRP or the O shot. You can do both in the same treatment. You just start with the laser first, and then you finish with your PRP or the O shot. So those can be combined.